So Vittorio Ricci was originally diagnosed with CMT when he was just 14 years old. And that was in 2021. Just a year after the gene's discovery, he learned that his CMT was caused by the mutation in the CMT-SORD gene. Since Vittorio's original diagnosis, his family's been involved in awareness and fundraising activities for the CMTA. Vittorio's mum, Jill Ricci, has been the facilitator of the Boston CMTA branch for over a decade. Thank you ever so much, Jill. And Vittorio has joined her as a co-leader of that branch. Vittorio is currently enrolled in the phase 3 clinical trial for govorestat, which is the proposed therapeutic being made by Applied Therapeutics, who've got a stand in our exhibition and our acceleration sponsors for this summit. He'll be able to tell us a little bit about his experiences, and he's been working closely with Applied Therapeutics on their FDA outreach, advocacy, and with the hopes of making sure that we achieve accelerated approval for govorestat, which would actually be the first drug treatment that is approved for CMT. So we're all hopeful that's going to happen soon. So please can I welcome Vittorio to the stage.
I didn't realize there was going to be a bio, so that kind of takes a little bit out of my introduction in the beginning, so that kind of helps. Good morning, everybody. My name is Vittorio Ricci. I'm 26 years old. I'm from the greater Boston area, at least formerly. I'm currently driving cross-country with my girlfriend and her 2 cats to move out to Seattle. So that's been a lot of fun. If I sound a little congested, I had cats crawling all over my face last night, so apologies for that. If you're curious about any of the places that we've stopped at during our drive, you can take a look at my car out in the parking lot. I have a Thule on the top, and I've been putting stickers from all the national parks and tourist traps that we've been suckered into. Just look for the white Ford Escape that's covered in dead bugs. A lot of bugs. But I'll give you a little bit more background on myself. I was diagnosed 12 years ago at the age of 14. I went through the same diagnosis procedure that I'm sure everybody else is familiar with, from doctors to neurologists, MRIs, nerve conduction, velocity, genetic tests, lots and lots of blood work. At the time, originally I tested negative for all known types of CMT, which at that time, I think was only 33 known mutations at that time. My doctors told me that they knew that I had CMT, but it would be many years until my mutation was eventually discovered. I continued seeing many different specialists in the meantime. I visited Dr. Shai's CMT Center of Excellence at the University of Iowa to enroll in a research program to identify new types of CMT. I visited with Ken Cornell and his staff at Cornell Orthotics to get fitted with my new AFOs. Right around this time, I was also starting high school, so I showed up as a freshman with my shiny new AFOs on, and I think because they came up in the front and kind of looked like shin guards, all the teachers were asking me, how are soccer tryouts going? Wasn't trying out for soccer. I did join cross country. So much easier than soccer, especially for people with CMT. I hope all the doctors and orthopedic surgeons are sleeping in, because I know that's not the best thing to do if you have CMT, but it was something that I was really passionate about, and I stuck with it for a pretty long time. It also meant I got to visit Ken Cornell and his staff a lot. I was breaking leg braces all the time. They loved having me in there. I was their little science experiment. Running helped me discover a lot about myself and how CMT affected me. I think my parents were a little surprised at how well I took the diagnosis, and I think looking back on it now, I didn't really understood what CMT's impact on my life was until I started running. I initially just thought, okay, I do some PT, I put on AFOs, and everything's totally normal, and that's not really the case. The first run I went on after the diagnosis was with a group of friends just to train. It was a short 3-miler, and they all finished it pretty quickly, and it took me over an hour. And my friends were so incredibly supportive, but deep down inside, I was devastated. I didn't really know what CMT's impact on my life was going to be. And it's one thing to be treated like a patient by your doctors, but it was a totally new thing to be treated like a patient by, friends and family and people who care about you. You get into this real horrible vortex of emotions, of anger and sadness pointed at people that are only trying to care about you, which leads to guilt, which leads to more like frustration at yourself and at the situation. And it's just this really horrible cycle that you can fall into. And I've noticed it in a lot of other younger people with CMT as well. But running, in a way, was my meditation, my way to confront with what I was dealing with head on. I went home after that first run and I thought to myself, I'm never going to let that happen again. So every other morning for the rest of the summer before going to work as a camp counselor, I'd get up and I'd run 1 mile. And that led to 2. And that eventually led me into my first cross-country season where I was able to get up to 5 to 6 miles a day, 5 days a week. And that was really amazing. I still had a few more things to learn. Not only did I have to train physically, but I had to train a lot mentally. It's, as a very competitive person, you definitely feel like your hands are tied when you're competing in a foot race with other people with a neuromuscular disorder. But I learned to let go of all of those frustrations and really to not compare myself to others, and to learn that the only competitor on the field with me when I'm out there was myself. Later on, when I was in college, I did run a full marathon. I was a little tired of being told that my short 5K races that I did in high school were impressive, and I wanted to do something that wasn't just impressive for someone with CMT, but impressive in general, something that even people without CMT don't normally do. It took me 6 hours to complete. It's not the fastest marathon time. I could definitely pin part of that on the CMT. I also chose a race in Vermont in the middle of August. It was 95 degrees out and sunny, which is a great beach day. Not a great day to run 26 miles. You might be wondering, how are you feeling afterwards? I didn't walk for a week afterwards. I really had no control of my quads after that. Anyways, right after I was diagnosed, my family and I became heavily involved with the CMTA. Gina Sweeney talked with my parents a lot over the phone when I was first diagnosed, explaining what this disease meant and putting a lot of fears to rest. And my mom was the one who first brought up the idea of doing a fundraiser. So our first ever fundraiser was at my old elementary school, Spofford Pond Elementary. All the classes raised money, and whichever class raised the most money got a pizza party at the end of the fundraiser. I also spoke to the entire school at the end of the fundraiser. My first time ever really doing public speaking like this. It's a little bit less intimidating when the average age of the audience is about 10, 11 years old. But from there, it really took off. I did a fundraiser with my freshman year of high school and also got up and spoke to my class and told them about my diagnosis and the whole process behind that. It wasn't long before I started seeing people in my high school that I barely even knew walking around wearing the CMTA wristbands, which was just an incredible show of support. My mom reached out to some of the local news channels, and we were featured in some short news segments as well. One of them resulted in a camera crew coming to my high school, which was cool. I tried to use that as an excuse to get out of chemistry class. They didn't buy it, not at all. And my family started hosting these huge summer cookouts every year in Gloucester, Massachusetts. My parents did an amazing job organizing those. We would have auctions and raffle prizes, all donated from friends and family and local businesses. My dad spent most of the time cooking for a crowd of over 150 people over an industrial-sized grill in the middle of the summer. I don't know how he survived that. My mom also started assisting the Boston Support and Action Group, helping to organize meetings at Mass General Hospital where others with CMT could meet and discuss mutual challenges and solutions. Before long, she was the co-facilitator and grew into her role now as the head of the Boston branch. Later, I went off to college at Northeastern University to get a degree in bioengineering. Kind of a pretty natural field, I feel like, for anyone with CMT to get into. Thanks to my passion for demolishing leg braces, I went in with a specification for biomechanics. While I was in school, I was invited to speak with a local pharmaceutical company in Boston that was working on potential treatment for CMT patients. We had a little panel with some of the employees there. And when I mentioned that I was going to Northeastern University, they asked me if I wanted to come on and do an internship with them because they bring students from there all the time. And that kind of kickstarted my career working as a lab scientist, which I've done ever since I graduated 3 years ago. It's very strange how these things work out. My career was kickstarted just by standing in front of a group of people, telling my story. Kind of like how I'm doing now. Did I mention I'm currently unemployed because I had to quit my job to move to Seattle? Does anyone know of any open jobs in Seattle right now? Let's keep the momentum going. I have resumes. I'll call my manager right now. 8 years after my CMT diagnosis, the clinic run by Dr. Shai identified a new mutation of CMT located in the SORD region. The research program... I was in my third year at Northeastern University getting my degree when this study was published. It was a very exciting time for my family. We'd been waiting such a long time to get this full diagnosis. Not only was it comforting to know exactly what I had and how it was affecting me, but I was quickly able to start looking for solutions. And not too long after that study was published, Applied Therapeutics reached out and said that they had a phase 1/2 clinical trial ongoing for a potential treatment for the SORD mutation. So I enrolled in that. I take an oral medication every morning, do some blood work once a month from home, and every now and then fly into one of the clinics in New Jersey. Very easy. I later rolled into the phase 3 clinical trial, which has been going on for 2 years. My 2-year data point was in July, and I'm currently in a 3-month extension. There's been a lot of amazing developments with this study. I know that the Applied team is going to be talking later, so I'm not going to mention anything else and try to steal their thunder, but it's truly amazing what's going on there. And it's really amazing to think that I waited 8 years for my full CMT diagnosis, and only 4 years after that, I'm wrapping up a phase 3 clinical trial for a potential treatment. And that's something I really wanted to highlight today, which is change. The change that I have seen in the last 12 years is astounding. The availability of research, scientific discovery, and CMT-focused resources has grown at such an incredible pace. I remember how difficult it was 14 years ago just to get a genetic test. And now we have ongoing clinical trials for potential treatments for all different types of CMT. There weren't many kids involved in the CMTA when I started out there. Now there's a youth group, the Compass group. There's 2 summer camps ongoing right now. I think the Compass group, I just heard, was up to like 50 committee members organizing events. It's amazing. And there are tons of them now. They're going out, they're hosting fundraisers, they're talking to people in their schools, and they're not afraid to tell people what this disease is and how it affects them. There's so much behind this movement right now, and we can see it at this event, just looking out at the back at all the booths that were set up yesterday, all the AFO and genetic and pharmaceutical companies that have their eyes on this disease right now. And it's thanks to everyone in this room, whether you've hosted fundraisers, posted about your diagnosis on social media, manage or attend branch meetings, enrolled in research or clinical trials, they all contribute to helping not only yourselves, but everyone else in this community. And for that, I'd like to thank everybody here. There are many other people I'd also like to acknowledge who have put me in this position to deliver this keynote to you this morning. I wish I could have all of them up on stage with me, but I will call all of them out because I did not get here alone. So thank you to Gina Sweeney for talking to my parents 12 years ago and convincing them to get involved with the CMTA. To Cornell Orthotics and the TurboNet Orthotics team for quite literally keeping me moving for all these years. All the organizers at the CMTA for putting this event on, and all the speakers that we've had both yesterday and coming today. Dottie and the Applied team as well for their real passion and work on the clinical trial. Of course, all my friends and family at home watching en masse. Hey, Grandpa. They're not going to like this part. My mom did email me and she's like, don't forget, to recognize some of these people, but she didn't include herself. So both of you, Mom, Dad, I'd like you to stand up, please. Stand up. I'm not going to make you talk. They have done so much work behind the scenes that I get to take all the credit for. So I'd like to just acknowledge them. especially to my mom for, doing so much behind the scenes and running the Boston branch. I know I get to be co-facilitator, but she does 90% of the work for that. So, but that's it for me. I'd just like to thank everyone here for attending and dedicating your lives in small ways and big ways to this cause. I hope you enjoy the rest of the conference and continue building this incredible momentum. Thank you.